Do you know this feeling? As if the foot is stuck to the floor in the morning, and the first steps are given with such pain, as if someone stuck a needle right into the heel? And then, after a few minutes, everything seems to pass. But, it comes back, until you stand on your feet again for more than half an hour, or walk an extra mile. Perhaps you attribute this to fatigue, age, or even uncomfortable shoes. But what if I tell you that the cause may be osteoarthritis of the tarantula joint? This is not a rare exotic disease, but a fairly common problem among people aged 30 to 60 in the United States, especially those who lead an active lifestyle, have been on their feet for most of their careers, or have suffered a foot injury. And yes, I've been through it myself. Let's start with the most important thing. What is the tar heel joint? Imagine that your foot is a complex mechanism consisting of many gears. Each bone plays a role, but it is at the point where the talus bone, it is located directly under the ankle, connects to the calcaneus, the one you step on, that a joint is formed that is responsible for turning the foot in and out. This is called supination and pronation. Without this movement, you would not be able to walk normally on uneven surfaces, let alone run or dance. Osteoarthritis of this joint means that the cartilage tissue that normally cushions bones and allows them to slide relative to each other is worn out. The cartilage becomes thinner, the bones begin to rub, and this is what causes pain, stiffness, and even swelling. At the same time, unlike arthritis, which is most often associated with inflammation, for example rheumatoid arthritis, osteoarthritis is a degenerative, that is, wearing out disease. In the United States, according to the CDC, more than 32 million adults suffer from osteoarthritis, and although it is most often the knees and hips that are affected, the feet, especially the middle and back, are affected much more often than is commonly thought. Here's an interesting fact. Many patients with osteoarthritis of the tar heel joint have actually been treating a completely different disease for years. For example, a heel spur is really just a calcium buildup on the calcaneus. And by the way, it's not always painful in itself. Studies show that up to 15% of people with heel spurs don't experience pain at all, while some folks have pain that's actually caused by osteoarthritis or tendinitis. Another common misconception is that osteoarthritis only happens to the elderly. In reality, here in the United States, a significant number of cases are diagnosed in people under the age of 50, especially after injuries. For example, a fractured calcaneus or a dislocated ankle in your youth can lead to osteoarthritis 10 to 20 years later. This is called post-traumatic osteoarthritis. And, yes, if you ever played football, basketball, tried skydiving, or even just twisted your leg on an uneven road, that could be the start of a process that's only now showing up. It's especially important to understand that heel pain isn't just age, it's actually a signal. And if you ignore it, the joint keeps collapsing. Over time, your movements get more and more limited. You start to limp, you change your shoes, you avoid stairs, maybe you put off hiking with your grandchildren. And honestly, the most frustrating part is thinking it's just the way to live. But it's not like that. Osteoarthritis of the tar heel joint can be slowed down, and in some cases, even stopped. And even in severe cases, you can effectively manage symptoms without surgery. In America, the medical system is set up so that you are really the main player in your own health. This means that, with the right knowledge, you can clearly explain to your doctor what's bothering you and avoid unnecessary tests or procedures. For instance, an X-ray might not show early osteoarthritis, since cartilage doesn't appear on it. In those cases, an MRI scan may be needed. And if your doctor suggests surgery right away, you have every right to ask for a second opinion. It's completely normal. Your Medicare or private insurance, like through an employer's ACA plan, almost always covers a second opinion. By the way, just to get a little personal for a moment, I lived in New Jersey and worked as a physical education teacher. Every day I was on my feet, taking 8,000 to 10,000 steps, jumping, running, and playing outside. But at the age of 42, I started experiencing this thing called morning stiffness. I bought expensive insoles, got massages, and even went to a physiotherapist. But honestly, the pain just kept coming back again and again. It was only when I finally visited an orthopedic specialist for feet. Here in the USA, we call them podiatrists. that I got an MRI scan and was accurately diagnosed with grade 2 osteoarthritis of the tarantula joint. At first I was honestly shocked. I thought, how come? I'm not old. But then it hit me. This isn't a verdict, it's a challenge. And I decided to accept it. Over the next 6 months, I gathered a ton of information, tried out different methods, and now I'm sharing them with you. Because really, I know what it feels like to feel inferior because of the pain in your leg. Another important point to mention, osteoarthritis of the tar heel joint is often accompanied by other problems. For example, flat feet or being overweight. And believe me, I'm not saying this to judge anyone. I gained 20 pounds myself after moving to Texas, and that honestly just made the situation worse. But research from the Mayo Clinic shows that reducing your weight by just 5% can cut foot strain by 15 to 20%. That's a huge difference. It's also super important to realize that the foot is the foundation of your whole body. If it doesn't work properly, your knees, hips, and even your lower back can end up suffering. So, foot care isn't just about making walking more comfortable, it's really about your overall health. Oh, and here's some more statistics. According to the American Academy of Orthopedic Surgeons, treating osteoarthritis of the foot costs Americans billions of dollars every year. But up to 40% of patients don't get adequate conservative treatment before they're offered surgery. The thing is, many of the methods I'll talk about in the second part are not only cheaper, but also safer. I mean, you really don't want to go under the knife if you can avoid it, right? Now, let's talk a bit about diagnosis. How do you know if you have osteoarthritis of the tarantula joint, and not, say, Achilles tendon tendopathy or tarsal tunnel syndrome? Here are some key signs. Pain that's localized inside the back of the foot, just above the heel and closer to the ankle. It gets worse when you turn your foot. It's more noticeable after a long rest, or after being on your feet for a long time. And it might come with a crunch or even a click when you move. If you press your finger on that spot and feel a sharp pain, that's definitely an alarming signal. But remember, only a doctor can confirm the diagnosis. Please don't try to figure it out yourself, it can be dangerous. By the way, in the USA, it's actually much easier to see a podiatrist than in a lot of other countries. These aren't second-rate doctors. They go through their own residency, and they can perform surgeries, prescribe MRI scans, and give you medications. Almost every clinic has their offices. And yes, even if you have Medicaid insurance, you're eligible for a consultation. Just check the list of providers in your state. And now the important question is, why does cartilage wear out at all? Genetics play a role. If your parents had foot problems, the risk is higher. But honestly, it's more influenced by mechanics. Improper gait, a high arch of the foot, excessive load, all of this leads to uneven pressure on the joint. Just imagine you're driving a car with improperly inflated tires. The tread is worn unevenly. It's really the same with the foot. Americans walk on concrete a lot, wear oversized sneakers, and work standing up. All of this creates ideal conditions for osteoarthritis. Another myth. If there is no swelling or redness, it means nothing serious. But osteoarthritis is not an inflammation, unlike gout or infectious arthritis. It can actually proceed quietly, without any external signs, until it's too late. So, don't wait until the pain becomes unbearable. It's so much better to come to the doctor with the question, what if it's, than with a cry of, I can't take it anymore. Fortunately, medicine does not stand still. Regenerative medicine methods are actively developing in the United States, for example, PRP therapy, that's platelet-rich plasma, or injections of hyaluronic acid. Of course, not everything is covered by insurance, but even partial relief is worth the effort. I did PRP myself, and the effect lasted for almost a year. But, more on this in the second part. For now, remember the main thing, you are not alone. Osteoarthritis of the tar heel joint is not uncommon, and certainly not a verdict. This is a condition that can be controlled. And in the next part, I'll share all the proven ways, from pharmacy remedies to home recipes, from exercise to financial life hacks. Yes, in the United States, even treatment can be cost-optimized. In the meantime, write in the comments the phrase from this video that most offended or surprised you. Please like it if you recognize yourself in these symptoms. And be sure to subscribe to the channel. there are still many useful, honest, and proven things ahead, because your pain deserves attention, and you deserve to live without her. Now that you understand what osteoarthritis of the tar heel joint is and why it occurs, let's talk about the most important thing: what to do about it. I know how you feel. You're tired of the pain, tired of maybe it'll pass, tired of advice like just walk barefoot. And the worst part is that you are afraid that you will have to have surgery, waste weeks on recovery, and spend thousands of dollars that are not in the budget. But trust me, there are dozens of effective, affordable, and safe ways to deal with this problem, even if you have regular insurance through your employer or Medicare. I've tried almost everything myself, from pharmacy creams to injections, from orthopedic shoes to yoga. And today I will share with you only what works, confirmed both by science and my personal experience. Let's start with the simplest but most important thing: shoes. In the USA, we live in a country where fashion often trumps functionality. Nike or Skechers sneakers may look stylish, but if they don't support the arch of the foot and absorb shock, they harm you. Ideal shoes for osteoarthritis of the tar heel joint should have a hard back, which stabilizes the heel, good cushioning in the heel, moderate stiffness under the arch, and a wide toe, so that the fingers do not shrink. Brands like New Balance, Brooks, Asics, and even some Hoka 11 models are great choices. And yes, you can buy them in a regular store or on Amazon. You don't have to look for medical models. But if you have a pronounced deformity of the foot or flat feet, you should contact a certified podiatrist for the manufacture of individual insoles, or orthotics. Important: ready-made insoles from pharmacies, for example Dr. Scholl's, are a temporary measure. They help, but they don't solve the problem. Individual insoles, on the contrary, redistribute the load and reduce friction in the joint. They cost from $300 to $600, but many private insurances, especially through an employer, cover some of the costs. Check your plan on the insurer's website or call customer support. Honestly, it's worth it. Now about the medicines. Usually doctors first suggest NSAIDs, non-steroidal anti-inflammatory drugs such as ibuprofen, like Advil, or naproxen, like Aleve. They relieve pain and inflammation, but they do not cure osteoarthritis itself. They should not be taken all the time. This is a risk to the stomach and kidneys. I drank ibuprofen myself for a couple of months until I realized that it was better to find a long-term solution. Glucosamine and chondroitin are much more promising. Although the FDA does not approve them as medicines, research from Johns Hopkins University shows that in 60% of patients, they slow the progression of osteoarthritis within 2 years. They should be taken regularly, for at least 3 months. And yes, in the USA, they are sold without a prescription at Walmart, CVS, Costco. Look for a brand with a USP, that's United States Pharmacopeia certificate. This is a quality guarantee. Remember, the effect is cumulative. Don't expect a miracle in a week. Another important point is physical exercise. Many people are afraid to move when they're in pain, but immobility actually worsens osteoarthritis. Joints, just like muscles, need movement to nourish cartilage. The key is to choose the right exercises. Running, jumping, and aerobics are definitely prohibited, but swimming, cycling, and walking on a flat surface are great options. Special attention should be paid to stretching and strengthening the muscles of the shin and foot. For example, picking up towels with your toes might sound a bit silly, but honestly, it works. Or try the alphabet exercise. While sitting, draw letters from A to Z in the air with your toe. This really improves joint mobility. Another favorite is stretching your calves. Stand facing the wall, rest your hands, place one foot back, press your heel to the floor, and lean forward. Hold for 30 seconds and repeat 3 times on each leg. If you do this morning and evening, you'll probably notice the difference after about 2 weeks. Now, let's talk a little about advanced methods. PRP therapy, or platelet-rich plasma, is when blood is taken from you, centrifuged, and then the platelet concentrate is injected right into the joint. Platelets stimulate tissue healing. In my case, the pain actually decreased by about 70% and lasted for almost a year. The procedure costs between $500 and $1,500 and is not covered by most insurance, but some clinics do offer payment plans. It's important to choose only certified doctors, preferably with experience in sports medicine. And please don't believe the Instagram ads. This isn't cosmetology, it's real medicine. Another option is injections of hyaluronic acid, like Synvisc. This substance is naturally present in the joint fluid and acts as a lubricant. Injections are given once a week, 3 to 5 times in a row. In the United States, they're more commonly used for knees, but they're also increasingly used for feet. Medicare sometimes covers these injections if other methods have not helped. So, ask your doctor if you might be able to meet the conditions. And now, just a little bit about home methods. Ice is definitely your friend. In case of acute pain, apply an ice pack, wrapped in a towel, for 15 minutes 2 to 3 times a day. It helps relieve swelling and pain. Warmth, but only if there is no swelling. For example, a warm bath with sea salt before going to bed really relaxes the muscles. But don't overdo it. Hot water can increase inflammation, if there is any. Nutrition also plays a role. In the United States, we eat too much omega-6, especially in processed foods and fast food, which, provokes chronic inflammation. And omega-3, which you can find in salmon, walnuts, and flaxseed, actually calms that inflammation down. Add turmeric to your diet. Curcumin, its active ingredient, is comparable in effectiveness to ibuprofen, but without side effects. Take it with black pepper. This way it is absorbed better. I drink turmeric capsules every day, and, honestly, the pain has decreased. Weight management is also important. I know how difficult it is to lose weight with leg pain, but even 5 to 10 pounds reduces the load on the foot by hundreds of pounds per day of walking. Start small. Replace soda with water. Reduce portions. Use apps like MyFitnessPal. They are free and work even with Medicare plans related to wellness programs. Now, about the financial side. In the United States, treatment for chronic diseases can be, pretty expensive, but there are some life hacks to make it a bit easier. First, always ask the clinic, do you have a sliding scale or cash pay discount? Many private practices actually give a 20 to 30% discount for cash payments. Secondly, use your health savings account, or HSA, or flexible spending account, FSA, if you have them. You can spend that money on things like orthopedic insoles, massage, and even some supplements. Third, check if physical therapy is included in your plan. It's very effective for osteoarthritis, especially methods like ultrasound or manual therapy. If all this does not help, the operation remains. But even here, there are options. Arthrodesis, or bone fusion, is a radical but reliable method. After it, you won't be able to rotate your foot, but the pain disappears completely. Hip and heel joint replacement is still in the experimental phase in the United States, but it is already being practiced in some places. However, most orthopedists only offer it as a last resort. The main thing is not to give up. Osteoarthritis is not the end of movement. This is the signal. Take care of me, and you can do it, without panic, without hysteria, with intelligence and dignity. And finally, if you've looked up to this point, you're already one step ahead. Write in the comments, I choose a life without pain, and I will personally answer everyone. Please like it. It helps the video get to those who need it. Subscribe to the channel. Ahead is a review of insurance, interviews with podiatrists, and real healing stories. Because you deserve to walk lightly. And I believe that you will be able to do it again.